So today we are announcing that we have 77 new cases tested here in British Columbia for a total of 348 people. This includes 200 in Vancouver Coastal Health, 95 in the Fraser Health Region, 30 in Vancouver Island, 19 in the Interior Health Region, and 4 in the Northern Health Region. Of those, 22 people have been hospitalized, are in hospital at the moment. 10 of those people are in ICU, and 6 have now recovered fully from this disease. I did want to talk as well. We have a couple of long-term care facility outbreaks, including in our numbers a new healthcare worker who's identified associated with the Dufferin Care Centre, and that centre is now being managed as an outbreak, as we do whenever we detect a case in a healthcare facility. So Fraser Health is addressing that issue today. In talking about healthcare workers, I think that is something that is always in the back of our minds as we've been going through this last number of weeks. And I do want to say that we have had a number of healthcare workers who have been infected with this virus. And today I really want to talk about my colleagues. I know how challenging it is when we are dealing with a new virus, a virus particularly for which we have no cure, we have no vaccine, we have no way of preventing it, and we know that it can cause quite severe illness in people that we love and people that we care for and people that we're close to. And it's been a tremendous challenge for our healthcare sector to watch what has been happening over this last few weeks and months around the world. And I have been watching with them very, very carefully and looking at what are the things that we need to do to best protect our healthcare workers and our healthcare sector here. And I want and so much, of course, in the beginning is very unclear. But I do want to say we do know so much more now about this virus here. And we know that hundreds of people have been safely cared for by our healthcare worker teams here in Vancouver, here in BC, here in Canada over the last few months. And we know that they're safely cared for because of the dedication and the intense practice that we have in our healthcare worker system. We know as well that about 24 of our healthcare workers here in British Columbia have been affected with this virus. And I'm relieved and happy to say that none of them have had severe illness. All of them have had very mild illness, and there have been some very short hospitalizations, but for the most part, people have been managed at home, and that is something that we're grateful for. It is everything that we do in the healthcare setting that keeps us safe from this virus. And these are things that I've talked with my colleagues many times over the last number of weeks. It's identifying cases early, and we've seen that around the world. It's when we have unrecognized cases that are in a hospital or in a care home that it gets transmitted. And that's when people can get sick, and that's when it gets passed on to others. It's making sure that we have administrative processes in place so we minimize the people that are in contact with somebody who's sick. We make sure that as soon as you go into the hospital, and we talk about this a lot, about the importance of calling ahead, and as soon as you go in with respiratory symptoms, you're given a mask to prevent you from putting your droplets out there, prevent other people from being exposed. It's the engineering things, like putting someone in a single room, like making sure we have the right air exchanges in our hospitals and our settings. And of course, it's the personal protective equipment that healthcare workers wear that protect them as well. And I know there's been a lot of angst and a lot of concern that we're not going to have the supplies that we need to best protect our healthcare workers across the spectrum, whether it's in the pre-hospital care, in home care, whether it's our community physicians, whether it's our hospitals, our long-term care homes. And I want to say that right now we have been working on this across the province and across the country, and we do have the supplies that we need right now. And we are committed to doing everything that we can to make sure that we continue to have what we need to best protect everybody in our healthcare system right now. And that's my personal commitment as well. Finally, I do want to say a little bit about The fact that we have had these social distancing measures in place, we've had gatherings that have to be curtailed, but we do need to make sure that we still have the resources that are available to support us. We need businesses to support our healthcare workers in particular, make sure we have food, make sure we have childcare, and details around our childcare strategy to support our essential workers will be coming out very shortly. But we also need to make sure that that there is appropriate precautions that are taken in certain settings to make sure that we are not allowing settings that allow transmission of this virus. And we go back to the reasons that we're doing this. The reason that we're doing this is so that we can build a firewall. We can prevent transmission of this virus between us, so that we can prevent the people that are the most susceptible to having severe illness or dying from this disease from being exposed to it in the first place. And that's the reason why we're doing all of these very extreme measures in many places. And it's become clear to me that there are certain settings where this is really a challenge. And we talked earlier about restaurants, and we put in some guidance around being able to maintain a distance within the restaurant. And it is becoming obvious, as it has to many of the municipalities around here, that this is a very challenging thing to do. So from today, my order is that restaurants must move to a takeout or delivery model only, as a way to best protect us and to ensure that we can maintain those distances. I also say that, for many businesses, they can and should stay open to support us, but they need to have the important social distancing measures in place to ensure there's not that many people in the office environment, for example. There's not face-to-face meetings. There's not congregation in groups. It's also important, and I've talked about this, for us to go outside. But like we do when we're inside, we need to go outside with our close family, with our small groups. We're not to be outside in groups. We're not to be out playing basketball. We're not to be out sitting together in large groups on the beach, watching the beautiful sunsets that we have. Because when we're out in groups like that, the chances are that somebody will be exposed to this virus, and then we'll bring it home to our family and our communities, and that is what is going to spread the virus. So right now, and again, this is not forever, but right now we need to be in small groups. We need to be with our family. We need to be with our close friends, one or two of us, and we need to maintain our distance with others. We must be united in these efforts, and we need to build that firewall and make sure that we keep it as strong as we can and that there are no gaps.